Over the years, I've had the privilege of generating over $75 million in revenue within the home healthcare and healthcare staffing industry. But let me tell you, it wasn't always smooth sailing. I faced countless challenges, made mistakes, and learned valuable lessons along the way. Now, I want to share with you the ultimate strategy for building a thriving home care agency, particularly when working with Medicaid and MCOs. Now, this is the same strategy that's helped propel our business to reach over 8 figures. At Passive Workforce, our motto is simple. We help healthcare entrepreneurs start, grow, and sell their companies. And today, I'm here to empower you with the knowledge and insights that you need to embark on your own journey. So get ready to take notes because I'm about to share some of the tips that I've used and the strategies to build my home care agency. And if you follow along, you'll have the confidence and the steps that you need to achieve the same level of success that I have. My name is Carl Pierre, and if you're new to this channel, welcome. I've been in this space for about 20 years now, and I share everything that I know right here on the channel. So if you like what we're doing, please like the video and subscribe to the channel for more information just like this. Before we dive into the nitty-gritty of building a successful home care agency, let's first understand the foundation that we're working on, and that's Medicaid. Medicaid is a government-funded program designed to provide healthcare coverage for individuals and families with limited resources. It offers essential medical services, including home care, to those who qualify based on income and other eligibility criteria. Understanding the ins and outs of Medicaid is crucial for navigating the healthcare landscape and unlocking its potential to grow your agency. Medicaid is a state-sponsored program, so it does get its money from the government, but it's handled on a state-by-state basis. So it's really going to depend on the state that you're in. The limits are going to vary. Some states have a very low limit, and it's hard to qualify for Medicaid, and other states have a surprisingly higher limit and allows more people to qualify. Other states have a limited amount of waivers that they will issue every year, and if that number has been met, then no one is allowed to enroll or has to be put on a wait list in order for new slots to open up. Either way, what you need to do in your particular state is really understand how Medicaid is structured. Where do you get an application? How does somebody apply? What is the look back period for financial qualifications? All of these things you need to become an expert in, because as you start to kind of position yourself as the expert in the space, you're going to have patients who come your way that aren't going to really understand their benefits, that can't necessarily afford the services out of pocket. And if you understand the nuances of enrolling and actually being qualified for those services, you'll be able to redirect those clients into the Medicaid program and help them get onboarded. Now, I don't want you to confuse this with Medicare. A lot of people just getting started in this business really don't understand the difference between the two. Medicaid is all about how much money you make. Medicare is a federal entitlement. So that's the whole country. If you're over the qualifying age and you've paid into Medicare along the years, then you are eligible. Now, Medicare is very different than Medicaid. Again, the payer sources almost seem the same, and even the name sounds the same, but they're very different. One is a federal entitlement, really governed by age. It doesn't matter how much money you're making. The other is a state entitlement, only if you qualify according to the income guidelines. And they cover, in some ways, the same things, but they each have their own nuances. And it's really important for you to understand the difference, because you're going to get phone calls from people who just contact your agency saying, hey, I need a caregiver for my mom, and she has Medicare. And if you don't know that Medicare is, first of all, something that you're going to have to enroll into separately from your license itself, you're going to say, yeah, I accept that. And you're going to ultimately not be able to take that coverage, and you're going to ruin your credibility. So it's important for you to know the differences and who qualifies. And sometimes there's people who are on Medicare who don't even know that they qualify for Medicaid. So again, if you know those nuances, you could actually get somebody onboarded into both. And those that really do have both have the most flexibility, because historically, Medicaid pays a lot less for private care. By private care, I mean like in community care, private physicians, specialists, etc. The Medicaid rate typically is a lot lower than Medicare. So doctors kind of favor Medicare clients. Medicaid isn't as widely accepted. And if someone has both, then they can benefit from getting both home care that comes with Medicaid and the other services that come with Medicare. Now let's take a moment to demystify managed Medicaid and managed care organizations as a whole. These are programs that partner with private insurance companies to deliver healthcare services to eligible individuals. Managed care organizations, also known as MCOs, are responsible for coordinating and managing the care received by Medicaid beneficiaries. Medicare Advantage plans, on the other hand, provide additional benefits to Medicare clients but doesn't cover long-term care, which is what most people that reach out to agencies are looking for anyway. By familiarizing yourself with these programs, you'll be equipped to leverage their potential and tap into a broader range of opportunities for your home care agency. Once you have Medicaid or Medicare even, and it's not associated with any MCO or any third party, it's what's considered like straight Medicaid or straight Medicare. And for the sake of this conversation going forward, let's kind of throw out Medicare for now, because Medicare, again, isn't going to cover the type of home care that most of you are going to be concerned with. We're talking about that long-term care piece. So when you're looking at long-term care, it's going to be a Medicaid program. Now, Medicaid in some states will provide services directly to the patient and to the agency. There's no intermediary involved. But in most states, there is this managed care model where these private insurance companies are stepping in and negotiating with the state and saying, hey, you pay us insurance premium. You're already overpaying for services. You have a really bad handle on how you're managing care to begin with. That's why it's so expensive for you. But we're a private company and we know how to manage this through authorizations and just really squeezing the most that we can out of our premium dollars. So the state then negotiates with these MCOs or these managed care organizations and says, hey, for X amount of $1,000 per month for every one of the members that enroll, we will pay you this premium amount, but all their care costs now fall on you. So that puts a little bit of pressure on these private companies, the Aetnas, the Blue Crosses of the world, United, etc. All of these private plans are getting the government money, but now they're managing it like it's actual premium. So it's really up to them. So the key here is that you need to research your state and know who the players are. Now there's going to be managed long-term care providers that are specialized predominantly in managed care or long-term care, I should say. And that's the plan that you want to enroll your clients into, because they're going to analyze your patients. They're going to evaluate them for how many hours of service, and their entire business model is on long-term care. But if you see some of the other MCOs, they have like more or less a HMO model, and that may or may not include long-term care. So you want to be careful, and when you're kind of researching who the active players are in your state, really trying to find out which one of those plans are the managed long-term care plans, because once you're able to help people enroll into Medicaid and then into one of these plans, you're going to be able to service that client for the duration of their life or for as long as they have Medicaid. And that's really the game that you want to play. So what you're going to do is educate yourself on the enrollment criteria. You're going to help people apply for Medicaid if they don't have it already. And if they do have Medicaid, you're going to move them along to the next step and help them enroll into one of these managed care organizations, preferably MLTC or managed long-term care. If the state doesn't offer that, or their enrollment is limited, you might want to find similar programs that are still administered on the state level, usually a little more red tape, but they do exist. If you position yourself to learn the ins and outs and partner up with these MCOs, helping them enroll clients, you'll be working in their favor, and they're going to be able to give you resources, free giveaways, pens, marketing materials, because a lot of them can't market directly to the public. So they need the agencies to kind of do their kind of on the ground recruiting, because certain states limit what sort of activity that they could have. They can't negotiate and kind of go into hospitals. They have a lot of little rules that they can't market in certain ways. So you want to make sure that you're kind of liaison with them, doing the work that they can't, but they ultimately become the payer. And if you guys are in bed, you're helping them grow their census, they're helping you grow yours. Most of these plans are going to have a provider relations department. So if you did research them and you went state by state or plan by plan and you researched all of them, you'll find their provider relations phone number. Contact them. Find out, are they enrolling new home care agencies? Sometimes they say that they're not, but if you are addressing a niche population that they're really trying to target, then they might open the doors to you. So that's going to be certain disease processes, certain languages, certain ethnic groups that may be underrepresented in that state. It could be rural areas that are hard to service. So you want to first get that list, contact them all, get in touch with provider relations, and see if they will contract with you or offer you what's called a single case agreement, which means that you don't have a formal contract, but they'll allow you to service patients on a one-by-one basis as long as you're bringing that client to them and that client wants you to be the agency of record. Once you've kind of paired up with a managed long-term care company, they usually provide you with a provider relations specialist. This is going to be the marketing rep or person that you're working closely with to help enroll members, do your marketing events with you, give you those marketing materials that I just told you about. And if you get fully vested with them, it's really going to be a wonderful alignment or ally relationship because, again, both of you are addressing your needs. One is enrollment and services. The other is you providing the home care services. So once you understand each other's main objectives, then you can line yourselves up. And that's really the way to go at this. When it comes to building a successful home care agency, education really is power. The key to attracting clients and growing your business lies in educating the public about the benefits and opportunities provided by Medicaid and its associated plans. By becoming a trusted resource, you could guide individuals through the enrollment process, ensure that they understand the options that they have and how to access the care that they need. By offering guidance and support, you position yourself as an invaluable partner, establishing a solid foundation for your agency's success. This may sound a little crude, but what you want to do is really position yourself so that you're able to target the Medicaid population. Remember, Medicaid is kind of income driven. And if you really look at any city, any neighborhood, you'll be able to kind of find the middle of the road, the low income, and the high income. And just because somebody's high income doesn't mean that they haven't arrange their finances to be Medicaid eligible, but for the most part, it's going to be the low-income folks. Go to the community centers, go to the churches, really go into these communities and spread your wings because oftentimes these low-income communities don't really get the messaging that they're entitled to these healthcare benefits. They kind of get forgotten. But if you align yourself with the community leaders, with the churches, with the food pantries, with any service that's really addressing this low-income population, and you're feeding information and assisting with it. It's one thing to just come in and say, yeah, I'm the new home care agency in the area and we'll help everybody. But when you're out there doing programs, educating people, Q&A, coming to locations, helping them with applications, or you hire a Medicaid enrollment specialist that sits there and goes to the building and enrolls 10 people a day to help them qualify for Medicaid, you become strategically aligned with the objectives of that organization or that building or what have you. You have to do these things. That's how you get your boots on the ground. That's how you get the first contact with people. Because if people come across a program independently, what happens is they sign up for Medicaid, their case manager turns around and says, oh, here's the plans that you could pick from. And then you just pick randomly. And then that plan tells them, well, here's the agencies that you could pick from. And then they pick randomly. If all this is happening randomly, what's the probability that they're going to land on you? One of the thousands of agencies. That's not going to happen. But if you worked with them from the beginning and you're Carl Pierre, the person who did my Medicaid application with me, the person who followed up with me, I just had my assessment. They told me I'm approved for 30 hours. They gave me the agencies to choose from. I told them I want to work with your agency. That's who you want to be. You want to be the name that's on your mind. You want to be the name that's on the case manager's minds. You want to work with the case managers to even help them with their paperwork because ultimately you're making their life easier. So by being aligned with them, helping them either get enrolled, making their lives easier, educating them, getting them the services that they need, ultimately that puts you in a favorable position to service that client at the end of the day. Now, some people target physicians when they're trying to get referrals. And this is kind of a slippery slope because most of the time the physicians there's not much of an incentive for them to refer to any particular home care agency. They're going to refer based on who they know, who's probably paying them under the table, or they're going to refer because of plan alignment. they're not really thinking about any particular agency, because at the end of the day, it doesn't serve them other than the follow-up care that they think their patients need. It doesn't really increase their billings. In some cases it might, because if it helps their scoring system and it might help them get rated better by Medicare, but ultimately they're not thinking about that too much. The way that you work physicians is helping them get new payers. For example, let's just say there's like a dual Medicare Medicaid plan, or there's a new Medicaid plan that came to market, and they're actually paying pretty good rates for doctor's visits, right? If they're not straight Medicaid and they enroll into this plan, it's better rates. So if you go ahead and you say, hey, I have such a great relationship with this managed long-term care company, or with this MCO that is covering doctor's visits, I could get them to add you to their network. That way, any of your Medicaid patients that are straight Medicaid, guess what? Instead of getting paid, $50 or $60 per visit, you're now going to get paid $150 or $180 per visit. So that's important to them. By just switching their plan, it's helping the doctor make more money. Now, it's always the patient's idea, but you know what the doctor's going to do? The doctor's going to instruct his medical assistants to give your pamphlets and to give them information about this new plan and tell them, hey, this plan is great. Your benefits are going to be better, faster appointment times, whatever the rationale is. But the reason why they're going to want to help you and the reason why they're going to contribute is because it affects their bottom line. So if you can do something where it's going to help them get more patients, more reimbursement, or anything that kind of aligns with their financial interest, you're usually going to win their favor and start building a relationship that way. Everything in this industry is about relationships and money, unfortunately. So once you're able to kind of align yourself with both, you're going to win. If you build an excellent system for these referrals, you can then leverage that into top paying contracts and the engine for your agency's growth. Referrals are the lifeblood of any home care agency. And when it comes to Medicaid and managed care, they hold immense potential. By developing a robust system for referrals and building strong relationships with healthcare providers, case managers, and community organizations, you can unlock a stream of clients and position yourself for maximum growth. As your agency becomes known for delivering exceptional care and results, you'll have the leverage to negotiate top-paying contracts with Medicaid and the MCOs that are in your area. This engine for growth will propel your agency forward and create new opportunities for massive expansion. When you get more advanced and you really see that this system is working for you, that's when you can start hiring marketing reps and additional resources to help manage this process. You can put out ads. You can start creating your social media to address these populations. If you create very localized social media where it's videos explaining how to qualify for Medicaid or how does long-term care work, people are going to find you. And since you're already sharing the information with them first, they're going to call you. Once you know what's working for you, that's when you can kind of crank it up. You can either crank it up by getting more boots on the ground and hitting up more referral sources, more churches, more food pantries, more physicians, more senior centers, more adult daycares, all of these places that are kind of providing you with these people. You could hire more boots on the ground to service them. And then you could expand your territory, go into new counties, apply for additional reach within your community. Maybe you're just doing one county and now you could augment your license to cover 5 counties within your state. Do the same thing. By having a clear system and knowing the output of that system, can you then decide to start dialing in, pumping more money, reinvesting into this marketing engine of yours, which is first positioning yourself to be the source of information, assisting people enrolling them into the plans, and lastly, servicing that client right on your roster. Thank you for joining me on this journey to building a successful home care agency using Medicaid. If you're looking to embark on this path and need guidance along the way, please don't hesitate to reach out to me and the team at Passive Workforce. We're here to provide the support and expertise that you need to put you on the right track for success. If you're ready to take the next step, book a session with us by clicking the link right down below. And if you're just starting out, I recommend watching this video right here to determine the type of agency that best aligns with your goals. Remember, success is within your reach, and we're here to help you achieve everything that you're looking to achieve. Thank you, and I'll catch you in the next one.